Welcome to the Raise Podcast. I'm Coral.
And I'm Natalie.
And we're here to help you raise your game whilst raising the next generation.
We want to help put the power in your hands and inspire you to live your life the way you choose. Ready to raise some questions?
Well, so are we.
Hello, everyone. On today's episode, we have Dr. Seb and his wife, Ali, with us. They run a clinic called The Wonder of Wellness, which integrates holistic health and modern dentistry.
Hello, guys. Thank you so much for joining us today. So can you tell everybody and us what exactly is biological dentistry and why did you start the Wonder of Wellness clinic?
Well, Wonder of Wellness was conceived in 2015, wasn't it? And it just came to Ali in her mind. And she was like, we're going to have a business called Wonder of Wellness one day. I wasn't even studying dentistry. Ali was, we just thought it was going to be a health and well-being thing because we were going on our own health journey and no one knew anything. And we had to get all our information from America and Australia or online. And we need to share this. And there was friends and family and they're like, oh yeah, they're getting better. And then it was like, God, we need to do more. So that was our first Instagram account, wasn't it?
Yeah. I think it was doing the Candida diet back when that was trending. So I was sharing recipes because I couldn't find anything else. And then I was we were working in IT, the corporate grad scheme. So it had absolutely nothing to do with what we were doing. And I was it's Wonder of Wellness bought the website. Seb was why are you buying a website? We work for an IT company. What are you doing?
Yeah.
And then, that kind of led into you going back to uni. Well, my health journey and your health journey.
So maybe we should touch on the health journey because that's quite pivotal, really.
So definitely.
Okay, so I'm a super rewind. I'm go, go, go. That's me in life, 100% or nothing.
Very better.
And and it burnt me out really doing things that I wasn't aligned with. So I wanted to be a dentist as a kid, had no idea why I wanted to be a dentist as a kid, but I didn't get the grades to get into dentistry first time. You needed all A's, A stars, and I got all B's. And I was F dentistry then. Maybe it's not for me. Maybe I just wanted to earn money and that's what it was about. And I went to study chemistry because then it was if I did chemistry and got a good grade, I could go and do dentistry, but also I could get a good grad scheme. So I was win-win. So then I went to Loughborough, which is sporty, and did chemistry and came out with a first. And I hated chemistry, absolutely hated chemistry. So that burnt me out because I just had to I was so focused on my sport and my degree that I didn't really have time for life and fun. And I was so rigid and very masculine, and there was no feminine in me at all. And that's where Ali comes in later. But so I then went traveling over the summer. We did South America and I got really ill in Bolivia. And it ended up being in intensive care for 7 days, missing my flights home, just thinking I was fixed, the medical way, with my oxygen, my antibiotics, So I had pneumonia, pulmonary edema, heart murmur, or lung scarring or something from the pneumonia. And so then I went back home and I thought, I'm fine. I'm healed.
Yeah.
That's it. And then I met Ali on the first day of the grad scheme because I literally came back, started this new job. And we had fun for 6 months, crazy fun as you do at 20 or 21. And then I just kept getting ill and my immune system was shot. It was I would have fish. We went to Croatia, I'd have fish. I'd throw up the next day and I was so sensitive to things. I'd come out of impetigo all over my skin and I've never had skin issues before. So my body and my immune system was just dodgy. And I'm obviously very chemistry, very medical based. And I was right, we've got private healthcare. Let's go to all the top immunologists. Let's see what's going on. And everyone was just prescribing me antibiotics, antifungals, antiparasites. And I get shivers now because it's just the wrong thing. And it was the wrong thing for me because it just lowered my immune system more. My physiological immune system from the steroid perspective, but then also my microbiome immune system and what the bugs that are trying to support our body's health as well, both were shot. So then I was I was literally depressed and I was getting up in the morning. This job, by the way, that I was doing at the same time, I was the super grad. So I was outstanding at everything, even with all this going on. So it was crazy. And I'd wake up in the morning and I'd always have to gym. That was my thing. I have to gym in the morning to keep my mind right. And I'd get up at 6 and I'd literally, because I was in a sales role, I could leave the office when I wanted to. As long as I got the numbers and I was doing things, it was all right. And I'd be at home 4 and I'd be asleep and that would be it. And I'd get up the next day. And at the weekend, we couldn't do anything. Couldn't go out. I just had no energy. I was super depressed. It was quite emotional talking about it really. And then Ali at the same time, probably good to talk about your story as well, because then they joined together.
So I've been fortunate enough that my mum's always been to wellness. And if I was ever ill when I was younger, it was like, right, go to the homeopath, go to the nutritionist. Like that's just how I grew up. And then I met Seb and never really had any issues growing up, probably because I was doing those types of things and eating organic from whatever age. And then met Seb, and Seb was obviously going through this journey. And I was like trying to suggest the natural way, but your family is very like was very like pharmaceutical. You'd done your chemistry degree.
Was.
Added that in there. But I was having these chronic headaches and migraines, and I couldn't really understand what was going on. And that process kind of just brought out all my like childhood wounding of like codependency and things like that. And I actually ended up with chronic health anxiety. So ended up dragging Seb to the doctors with me, going to see absolutely everyone, like trying to understand what was going on because I just didn't feel right in my body.
In parallel with the stuff that was going on with me as well.
Yeah, in the parallel of stuff that was going on with Seb. So we were right from there. We were together
like for 6 months and then that was it. It was like, oh my gosh.
I know I love this guy, but like, he's depressed. And I'm like falling to pieces, like dragging him to the doctors every week. Anyway, long story short, ended up going to see this top person because we had private health, and they looked at Seb.
It's for the migraines, right?
Yeah, it was to help with these chronic headaches, migraines. I was sat like with like a wheat bag on. I was trying all the natural stuff. And
changed all her desk around, at work with all the ergonomic stuff. Crazy, seats. And I was like, what are you doing?
Special,
It's full into bits.
It didn't work.
And yeah, it became a really mental thing. I was like, I need to find out what's wrong with me. Something's not wrong. No one's understanding me. I need a doctor to tell me this. Went to see this top doctor we'd waited for ages, sat down opposite like this, looked at Seb, not even me, and went, it's all in your head. It's all in her head. And I was like...
I said, thank you. I knew.
And it was like a light bulb went off because I'd just got so used to like this constant searching outside of myself for someone to tell me what was wrong. So I was like, right, doctor's not going to help. Let's do it myself. I haven't seen a doctor since then at all.
Amazing.
Like I just have done self stuff, gone for like naturopaths if there's ever had any
how many
issues.
Years ago is this?
Like 9,
14.
10 years. Yeah.
Wow.
Yeah. So like 10
10.
years ago. Yeah. Anyway, I ended up on Reddit forums, which are a dangerous place, but ended up finding out about like the jaw connection, jaw issues. And my personal experience, obviously this isn't everyone's experience, but I had 4 teeth taken out for braces when I was 16. It's called like extraction orthodontics, 4 on the floor. Like there's loads of...
There's a syndrome associated with this now. It's called extraction retraction syndrome.
Oh, wow.
And people get depressed from it. And that's a medical term now that's coming out in America, but it's not here yet.
Yeah.
But the NHS mostly does this type
I'm
of
allowed to
orthodontics.
talk about it from personal experience, but maybe not Seb. But yeah. So I had 4 teeth taken out, chronic headaches and migraines. So then I was like, right, I need to find someone to help put my mouth back together, basically. Ended up on a mad search. And Seb was like, what's going on? And we ended up going to a dentist in Sheffield. Meanwhile,
even before that, though, do you remember Patrick?
Yeah, I went to loads of
in Harley Street.
Yeah.
And he was like, the only thing you can do is because she had an MRI and her jawbone had worn so much from all the clenching she was doing at nighttime, which we'll talk about why it was there. You're going to have an operation. We're going to have to re-sew the disc back into place. So, because when your jawbone grinds against the skull bone, it releases like huge inflammatory markers into the body, which causes... Well, it's actually airway collapse that causes all this stuff, which we'll talk about later. But it was that then set us on the dental route. We're like, oh God, we can't have surgery for at 20 years old.
And there was like a 50% chance of it working. Yeah. It was really like, it was so close to your brain and everything. Yeah. It was really risky. And I was like, because this just doesn't fit. And it was 21 grand, by the way. Wow. And private healthcare didn't cover it. And I was like 23, like we'd moved in together. And I was like, yeah, that's not an option. What else can I do? So I ended up finding out about like expansion orthodontics and something called the ALF and something called the Homeblock, which wasn't in the UK. So anyway, that sent me on this search because I knew I needed someone to help. Ended up going to craniosacral therapy. That gave me space between these like headache periods to the point where I was like, I've got to train in this because it was just life-changing. I went from literally being like debilitated pain and like taking painkillers, which I really didn't want to do. And then to actually having like, it felt like I had space in my life again. So where are we? So you're not doing well. You're on like your 9th course of antibiotics. You're still not wanting to listen to me, which is
But do you know what? Even the doctors, yeah, exactly. But even the doctors, some of the doctors, I was going back for these antibiotics. They're like, we shouldn't be giving you this, and then I would get angry at them. I'd say, I need them.
Shout,
I need them because that's what I thought was right. I thought the pill was going to fix everything.
Yeah.
And it was actually one lady doctor that I went to, and I was like, I'm so sorry afterwards. But no, I've not met her since. But I'm thinking, I'm so sorry because you actually were trying to tell me the right thing.
Yeah.
Maybe she'll listen to this.
Hopefully.
So you were doing all your antibiotics. I was like, oh, this is the thing. And then we went to see, I can remember his name was called Prof Bostroff, and it was like this house, and it was like in Notting Hill.
He's like 85 years old.
Like 85 years, and it was like all prim and proper, and he like brought tea in China, and we were like sat there waiting for Seb to see the specialist. And you best say this, because it was like a pivotal moment for you.
So this guy basically just looked at both of us and he said,
falling to bits at 23.
Yeah, he's like, what are you doing with your life? Like, what are you doing with your life? And I was like, well, I'm in sales. He's like, do you enjoy it? I was like, I only look forward to one day a month. That's it. The day that I get paid. Mm-hmm. And he was like, well, what do you want to do with your life? And I was like, well, I did want to be a dentist. He was like, well, I'll hook you up at King's College London. Get shivers talking about this. And he put me on the admissions thing with this. And I was like, so I went and had a meeting and like, oh, you've missed this year's intake. So you've got to wait another year. So I was like, oh, it's not a bad thing. I can save money, blah, blah, blah. And in the end, we decided to move to Manchester because we could buy somewhere and then not have to rent and, blah, blah, blah. But that was the journey. And he also said, stop sugar, do the Candida diet, which was kind of what we were doing already with Ali's family, like nutritionist, homeopathic person that was helping us with the gut microbiome testing and things like that. And that was the start of my journey. And what's funny is that Ali's struggles that I saw for her airway issues, remember the airway collapses, that causes clenching grinding, which causes jawbone. Typically there's the skull bone, the jawbone, you've got a disc in the middle. But if you clench and grind so much, the disc pops forward and you grind the bone to bone. So that was shown on Ali's MRI that the disc was the wrong place that it should be. Oh. But when you expand the top jaw, you will release the lower jaw forward, which then allows the disc to recapture and reprotect.
Interesting.
So that's what we found out later. But there was no one in the UK doing this apart from this one guy in Sheffield who mentored me in the end.
Okay. Yeah.
And well, there was a few, but he was one of the big ones. And so I was going on my own microbiome journey at this point. Ali was going on an airway journey, which we had no idea was airway until later in life.
Reddit forums.
Yeah. And then for me, it was like biological dentistry, going back to that original question, had to tie in all of these things because, it's more and more private dentists are actually doing the microbiome testing and stuff now. I say more. There's probably a handful in the UK that are doing it, which is good. But it's like you need to look at the airway too. Because the airway is obviously linked to your autonomic nervous system balance, right? So if you're fighting for oxygen at nighttime, you're putting your body into fight or flight all night. So then what's your nervous system going to be during the day? You're going to be anxious, you're going to be stressed, you can have low oxygen saturation. So it's like this whole, for me, the airway is the first piece to look at, the breathing, the sleeping, as well as all the other stuff that you have to do. But you're not going to heal if your body's stuck in fight or flight. Because your body's not going to have, well, you don't heal because it's focused on getting you out of there or fighting, right? It's not resting and digesting and rebuilding. So for me, it's such a key point. And if I think about all my patient base that I treat, the ones that heal are the ones that really put time, energy and money into the breathing, the airway, the sleeping piece. So yeah, a bit of a tangent there, but it was...
No, so interesting.
It is interesting, isn't it?
Yeah.
And it all just makes so much sense, doesn't it really? But sometimes you just don't know where to look.
Exactly.
And I think this is what you guys are doing amazingly. It's breaking it down for people.
Thank you. Yeah. It makes sense though. I was like, if you've got your teeth, if you've got like a big lorry on the road and you took out whatever percentage, I don't know, the percentage of 4 teeth out, like there's going to be instability.
Imbalance.
So why, if we take 4 healthy teeth out of the mouth, which is designed to have, all the teeth, I can never say this word, interdigitate. Is that the right word?
Say it again.
And they fit together perfectly, or they're designed to fit together perfectly. And you take 4 out, well, there's the whole issue around like teeth and meridians. So your teeth are the end of your meridian channels. So if you're pulling out a perfectly healthy tooth, what's that doing? And interestingly, the meridians of the teeth that I had pulled out was gut issues. And I only started getting gut issues and food sensitivities after I had those 4 teeth taken out.
It's so interesting.
Yeah.
That is crazy.
Yeah. So it's crazy.
Whenever I have to do something I have a big poster on my wall and it's each of the teeth and what's related. And when I remove a tooth or a tooth been root canal, I'll ask them, do you have this issue? Do you have that issue? And it's fascinating.
So there's like a mouth map that correlates to different parts of the body.
Yeah.
I'd love to see that. That's really interesting. Okay.
Get a link or something to share.
That'd be really
people
helpful.
to have a look at.
But the Swiss and the Germans, they inject, that you can't get in the UK, something called Procaine. And Procaine is an anaesthetic, But when you inject an anesthetic into an energy point that is misaligned, there's a big infection on it or something, interference there. For 24 hours, you inject it, it will become normal. Like the body doesn't recognize it anymore. So then that person will I have no knee pain anymore. And then that is affecting the body. And I get shivers talking about that.
I just got shivers again.
So, but we can't access that in the UK. How stupid is that? It's like, let us do what's right for people.
So why do you think we can't access that in the UK?
Know. It's just not licensed.
Okay.
And NHS.
Licensed.
I think because we've got the NHS, which is obviously, like, it's amazing. It provides...
It's reactive.
Yeah, but it's very reactive. It's like, I'm not knocking it at all. Like, it really helps at times. But I feel like people rely on the NHS. I think it's a mindset thing. I feel like people in other countries where you have to pay for healthcare, I feel like people take more autonomy with their own health and they're more proactive because they don't want that massive medical bill at the end of it. I think it's a mindset thing that in the UK, because we've got that, people are like, okay, well, I don't really have to try that hard because if I do get sick, I've got the NHS to fall back on.
Yeah.
And then dentistry, I guess, it's just how it's been, and it's systems and structures that have been in place for however many years, and systems and structures like to stay as they are.
Yeah. So this all happened, and then at what point did you then decide to open the clinic?
Yeah. So we moved to Manchester. I started the 52 trips across to Sheffield to get braces and to undo everything I'd done. You went back to uni on like an express course. You had to do normal dentistry because I'd done chemistry.
But it was a good one because it was express, but I was also working in NHS practice for 3 years. So the first year was 2 years of theory in one and practicing on these fake heads. And then the last 3 years was just treating patients in Accrington, Carlisle, Blackburn.
Yeah.
Literally everywhere.
All over.
Yeah, it was pretty crazy, but good.
And then another synchronicity. So then there was a biological dentist in Huddersfield, which was like probably the most famous one in the UK. But you couldn't get in with him. Like you would ring, you just can't get in. Like my mum tried to get in with him for years, couldn't get into him. But then one of the times where I was having my braces adjusted over in Sheffield at this other dentist, we were you'd reached out to this dentist trying to shadow him.
He did email me back that then.
He did, but like it just wasn't matching up. And then we were in Sheffield, like randomly getting my braces sorted.
The after work appointment.
Yeah, and he was there.
He was in the waiting room.
Because I'd been on the website, I was like, Seb, that's John. That's who you want to go speak to.
No.
Did you go and speak to him?
Yeah. And then you ended up shadowing
him and Alan for all of the reading weeks, summer holidays.
Christmas, you'd go across.
And just learn and watch because I didn't want to become indoctrinated with what we were being taught and I wanted to have the balanced view. And I would then go back and implement these things. And they'd be like, you can't do that.
Yeah, but that must be quite difficult though.
That was hard. Yeah, that was hard. But I knew, right, it's going to be all right. And then as soon as I finished, I was like, I can't work in the NHS, which you meant to be a foundation, the junior doctor route.
That's like the conventional path. You don't have to do it. It's not like mandatory, but it's just what everyone does.
You think it's mandatory because that's what's portrayed to it. But I was like, anyway, he took me on straight out of university and then I was working there for 5 years before it all happened. But it was, crazy how these things just fall into place. But talking earlier, outside of this, I was saying how Ali is like my barometer and my guide, and she provides the wisdom in our relationship for sure. And I'm just like the go for and do it. And she's like, you can do that, Seb. You don't have to go and do the NHS. Like, will I be good enough? These are private patients. What am I going to do? It's like these whole like belief systems in your mind. And you know what? I absolutely loved it. They loved me, and it was just a good step in. And do you know what happened all around the COVID time as well? So I was naturally getting longer for my appointments because of the whole, waiting in between. So instead of having like half an hour appointments for patients, having like 2 hours, I was like, this is the perfect route into private dentistry, It was just worked out beautifully, didn't it?
Yeah, it worked out well. So then we were talking outside earlier about dentistry, how it works when you have a practice. It's like there's some stuff dentists love doing, like their bread and butter, and there's other bits they don't want to do. So Seb was getting all the stuff that the other dentist didn't want to do, but not many new patients. And I was just like, my background's obviously marketing. And then I was like, let's just set you up a social account, because I was looking for a dentist like you 3-4 years ago when I was having all these jaw issues. So we set up your account. We just switched your personal one over. We were doing essential oils at the time as well. So that was like our step into like natural
that's
health.
what Wonder Wellness eventually became.
We were teaching like essential oils and things like that.
The natural medicine
and all that stuff.
Yeah.
And then, are we allowed to say natural medicine?
No.
natural medicine. And then, it just started like blowing up. And then I was like, right, we need to brand you. We need to get a brand image. And then it's just got bigger and bigger and bigger. And then the practice came about, to come back to your question, just the demand. So the demand for Seb, he was getting booked up.
Was this because of Instagram?
Because of Instagram and then word of
yeah.
mouth, like a lovely, good-looking dentist who knows his stuff.
Just a look. Skills,
empathy, care, presence, all the things.
Probably is all of us.
I'm joking. You just ended up so booked up. So it was gone from like, we need to fill your diary here because as a dentist, that's how you make your money. Like, let's fill your diary. And then it came to like, oh, let's grow awareness. And then it was like, how many people don't know these things? And then Seb was getting people coming like, I've implemented what you said and it's literally changed my life. I was like, we have a duty here. Like, try not to use the word duty, a devotion to share this information for the people like me years ago who were looking for this information. And then also like there's so many different levels, and this brings you to your pillar piece.
And the biological dentistry piece,
Yeah, how many different pillars there are. There's all those different people that everyone's got teeth and everyone goes down this conventional route of like fill and drill. And if it's a problem, you do it, and braces and aesthetics. Like that's what dentistry to me like looks like in the UK now. Like it's all about making your teeth look beautiful rather than function. So it's like function and form first, and then kind of the cherry on the top to make them look nice afterwards.
Yeah. Which I'm no good at actually, so I've got someone working for me to do that stuff. Yeah, so don't ever come to me to make your teeth look good. Pure function surgery.
It just got bigger and bigger, and then we're like, 5 years plan. Like I had this thing in the back of my head, like Wonder of Wellness will be a wellness practice. And then we went away last January, and like I love to do like the money mindset stuff. And this hotel we went to was a stretch. I was like, Seb, can we do it? I was like, I just feel like we need to go here. So we split the holiday in two, had 5 days at the cheaper hotel, 5 days at this like upper limit hotel. When we were at the upper limit hotel, as soon as we got there, we got a message from an investor. Like
just random, just a patient that come to see me.
Can you stop giving me goosebumps, guys? Like every time you say something.
And it was like, we decided then like 5-year plan, this is the plan. We'd created an online course. I'd switched from like doing my cacao ceremonies and craniosacral therapy and all the things to like, I'm just going to support Seb. Not just, I want to support Seb, and then let's just see what happens.
It's not even me though, is it? It's the message.
Yeah.
It's the biological dental message.
And the course, we created an online course, which we can come on to in a minute, because that's like accessible worldwide. And we've kept the price point
amazing,
like a quarter of what everyone else is charging.
Yeah.
Because it's like, if we can, we'll come on to that in a minute. So we'd like set the vision like 5 years time. And then day one at this bougie hotel, this investor reached out and we were like, that was quick. Got home.
And I got food poisoning. So I was like proper up and mitten. I was like eating all these fancy like, what was it, like sea urchin foods and stuff.
Yeah,
and my body's like, Seb, you're
not having it.
Yeah, not having it. I was like, no, you're not there yet, Seb.
So we got home. This was like January 23.
Yeah.
We got home and Seb was working like his butt off, which he always does. So I'm meeting with these investors. A building just appeared out of nowhere. We were doing this big 5,000 square foot space. And we were having like hyperbaric oxygen chambers, cryo. So I was like planning and pricing this all up. We're having a wellness studio, like cafe.
Sounds like the friggin' dream.
It was the dream.
On paper.
It was the dream on paper. And this was the maddest thing because it was like the vision. And like even now I'm like, this is the vision.
Yeah.
But we sat, and we were renovating a house at the same time. So we're living in we'll call it a lodge.
How many hours
it's
do you
not
have
a caravan.
in your day?
Exactly.
Yeah, I'm looking forward to some space.
We're living in a lodge. I was project managing the house to do all wellness related as well. So I was having to check on the builders to make sure there was like no mold. Everything was super sealed. Like, can we use this material? So doing all this. Sat in the caravan on a Sunday night and we were like about to sign the house, which wasn't fully built yet, over for this deposit on the dream, right? And we looked at each other and we were like, what were we doing? We were about to sign the next day.
Just a quick break to talk to you about Happy Mammoth. At Raise, our goal is to help women and mothers to live their best lives, and that's exactly what Happy Mammoth want you to do too.
They are dedicated to helping women take control of their well-being at every stage of their life. Hormones are essential for our overall health and happiness as they impact everything from our energy levels, sleep, to our mood and our focus. And when they're out of balance, well, life can feel pretty out of balance too. which is why we're excited to share Happy Mammoth's Hormone Harmony with you.
Hormone Harmony isn't just for women going through menopause, it's for anyone experiencing the effects of hormonal changes. We both take Hormone Harmony as part of our daily supplement go-tos and are so impressed with the ingredients and benefits we feel from taking it. They're packed with adaptogens, which are really powerful herbal extracts that help your body manage stress, and it's designed to naturally restore balance and help you feel like yourself again.
You may have actually seen Hormone Harmony on social media already because women cannot stop raving about how it has transformed their lives. A bottle of Hormone Harmony is sold every 24 seconds.
So whether you're navigating life's transitions into menopause or just looking for hormonal balance, check out Hormone Harmony from Happy Mammoth, because life's too short to let your hormones hold you back.
For a limited time, you can get 15% off your entire first order at happymammoth.com. Just use the code RAISE at checkout.
What's crazy, at the same time in parallel, is the place that I was working was selling the practice, but they were selling it for like $1 million, $750,000.
Yeah.
We can't. That's the same price as setting up your own thing.
Yeah, and we were like, we'd
But that
rather
didn't
set
make
it up and
sense.
do it perfect. So we had this option. I was like, no, it's too small, like ego. It's too small. It's not right. And we had this like massive, shiny, sparkly dream. And then this other option, which was the safer option, but it was really expensive. Anyway, we were about to sign on the Monday morning.
We said no to that first, didn't we?
Yeah, we said no to it.
Not knowing what else we would do. And then I got a call from the finance director.
On the Monday after
I
the
said
Sunday
no.
night, we said no.
And he said, we're going to give it to you for this price now, which was like
our jaws
10th of the
dropped.
price or something.
Literally.
And we were like, what is that about? So we're like, right,
Oh,
okay.
that's it now.
Trust the process. Trust the process.
So within 24 hours of about to sign for this multi-million-pound thing where we needed this massive investor, we said, let's just wait 48 hours. 12 hours later, you got the finance call. They told us the price. Then 24 hours later, we took money from our house build fund to put the deposit down on the business.
So it's all yours.
It's going to take normally takes 4 to 6 months because we had to get CQC approval to be a new dental practice, new brand, blah, blah, blah. 8 weeks later, the sale went through.
Yeah, it's crazy. We're like, God, I need some dentists. What's going on? Just
what
me?
do we do?
So then for the first 3 months, I was just, it's been a crazy year, to be honest with you. But I guess coming back to the biological dental question is my vision on, my belief of what biological dentistry should be is that you look at the airway, the sleeping, which we touched upon earlier, the autonomic nervous system regulation. That is a foundational piece. You remove the metals from the mouth, the second foundational piece. You look at the infections.
In a safe way.
In a safe way.
I was just about to say,
In a safe way. Yeah, in a safe way. You look at the gums and the microbiome, and then you look at the infections around root canals in the jawbone from previous extractions, wisdom teeth extractions, stuff like that can be hampering the body on a low-grade chronic inflammatory perspective. I guess it's not an infection, so it's not like, wow, you're going to die. It's like it's a drain on your system, like a burden, a percentage that it's using of your body to encapsulate and heal this every single day or keep it from entering the body. And, and you build from that. You start small and you build up. And biological dentistry in the UK, there was one person who was doing one thing, another person doing the other thing, another person, and for me, how's a patient going to know if they go to one biological dentistry that calls themselves a biological dentist? How are they going to know that they're not getting the full piece? Mm-hmm. So then my awareness online was for that whole piece for patients. But then also in my clinic, I need to be able to do the whole thing, which is what we talked about earlier with me. The first 4 years was just going around learning from all these top people that are doing all this so I could bring it to the UK and make it a piece of biological dentistry. And that's why I want to call it, because it's more science-based, it's evidence-based, it's got research behind it. And in the next 10 years, it should be the only way dentistry is done, because that is your foundation. And then you make things look good on top of that, right? Because otherwise, you're not living a good health span, wealth span. So
you're really setting the bar high for
trying, but I can't do it on my own. So now for me, it's like my vision is the clinic humming and flowing and being able to offer the diagnostic testing, the people doing the specialism within this practice, that people are good at the aesthetic piece, people are good at the surgery piece, good at the orthodontic piece, good at the just normal removal of teeth, but doing it in a good way, safe removal of amalgam, safe removal of metals. So then we've got that whole piece there. And then once that cookie cut is there, then, it's about creating a postgraduate diploma for dentists to come and learn. and to do and to practice no matter what they want to do. But when they do these things, they do it safely for their patients, because it's not like, oh my gosh, we're going to remove some amalgam today and the patient's going to be ill tomorrow. It's going to be like a slow thing that builds up in their body, and then they'll be looking for the answers. And it's, a lot of the time,
if it's not done correctly.
If it's not done correctly. And a lot of the time it can be dentistry, that no one looks at dentistry, no one looks at the mouth. But if you go to the top healing clinics in the world, the Paracelsus, the Swiss Biohealth, the ones that people are, have given like years to live, and they go to these places of healing. And what do? The teeth at the same time as the body, because they believe it's that ingrained. And they're the people I learn from.
Yeah.
It's a minefield as well, like of information and wisdom.
So we love a routine, and we'd love to know what your oral healthcare routine is, like what you do in the morning and what you do in the evening.
It's interesting, isn't it? Because so this, I guess, is breaking down the microbiome piece, because depends on the landscape of the bugs that live in your mouth. You can probably tailor your routine differently.
Okay.
And we're definitely working with people at the moment to, one, do saliva testing and for the microbiome, but also the inflammatory markers that are in the mouth as well. So if you've got a lot of inflammation in the mouth, that one, your body's trying to fight things off systemically and it's going into the mouth as well. Or you've got bugs in the mouth that it's trying to fight off as well. And then we can make things more bespoke and tailored for more people. But let's say for the average person, you want to brush twice a day. That's the normal one that everyone knows. For me, coconut oil pulling is like the best thing, because
we love oil pulling.
One, it whitens your teeth, lifts the stains off the teeth. Two, it coats the teeth. And even studies show that two groups of people that did the oil pulling, the group that didn't, the group that did 50% less plaque and calculus buildup, because the oil that's on the teeth stops things from building up. From my perspective, the coconut oil pulling as well does the myofunctional piece, which is a part of the airway journey. And that strengthens the tongue, because when you're pushing your tongue to push the oil through the teeth, you're actually exercising that tongue muscle, which then when your tongue is strong and lives in the right place, it doesn't block the airway. So you're also doing that piece as well. So coconut oil pulling is like it makes sense why they did Ayurvedically.
Only because I get asked this on Instagram a lot, and I assume that everybody knows this. Briefly, what is coconut oil pulling?
So you can just use organic, pressed, cold, oil that you cook with, and you just put a teaspoon in your mouth. It will melt, and you just swish it. But swishing is the wrong word. It's pulling, because you use your tongue to push, and then you use your the suction to pull, and then you're pushing through the tooth. You're pulling through the tooth, so it's going between your teeth. So it's cleaning in between your teeth as well.
How is this?
So it's not like a little swish. You really should be focused on the movement.
It should ache, exactly, because you're using the muscles. To relax.
Surely it's good for your jawline as well.
Absolutely. Myofunctional therapy in general is good for your jawline.
Okay. And do you both do that?
In the morning, for sure.
In the shower, how long? I find because it melts. And to begin with, you're like, but then once you get used to it, and it's like habit stacking as well, because it's one of those things. So morning shower, coconut oil.
We're literally the same.
It just helps so much.
And I do mine while I'm doing my exercise and like stretching, because you can only breathe through your nose. So then you're also nasal breathing while you're doing it as well. So I'm lifting weights while I'm coconut oil pulling.
Wow, that's a sight.
It's pitch black at that time.
Even I don't know that. And then copper tongue scraping?
Yes, once a day. You don't need to do it
twice.
twice.
Tongue scrape after. So also, do you brush your teeth? Because I get asked this as well. Do you recommend brushing before or after oil pulling, and then tongue scraping? In what order?
So remember when we were talking about the microbiome?
Yeah.
I know I've got a good microbiome living in my mouth, so I actually don't brush my teeth in the morning.
Okay.
You don't like mic drop a dentist only brushing his teeth once a day.
Because the microbiome can have beneficial things for your mouth. It's meant to be in there. If you've got the commensal bugs living in there, they remineralize your teeth. They take minerals from the food that you eat and they put it back into the teeth. So I do it at nighttime, of course, but and it makes sense doing it at nighttime for me, because. And this depends. I'm not recommending everyone to just brush at nighttime, especially if the bugs in your mouth are not good, because you want to get them out the mouth, right? You've got to cleanse and restore it before you can do this type of stuff. But if I'm coconut oil pulling in the morning and then I'm using salt mouthwash just to get the oil out my mouth once I've spat it into the bin, then that's all I do in the morning. And tongue scrape. So,
but for someone who does brush their teeth, you'd say, would you brush?
So I would in the morning or the evening, because it's quite different. Isn't it?
Do you all pull both?
No.
Okay,
and so he doesn't brush his teeth in the morning.
No, but for someone who does brush their teeth,
what would you recommend then?
So let's just say everyone that's brushing their teeth twice a day.
Sorry.
The best way of doing it is cleaning in between the teeth first, which I just do at nighttime, not in the morning as well. And then you tongue scrape,
Okay.
and then you brush your teeth.
And then oil pull.
Oil pull
the very first thing.
Oil pull's first.
Yes,
Okay,
definitely
sorry.
the first thing to do.
For the fourth time.
Yeah.
Yeah. Okay, so one more time. Oil pull.
Yeah. To be fair
Incidental.
though, it's not prescriptive. And I think it's whatever's going to
Okay.
fit into your routine. Like Ali was saying, habit stacking, as long as you're doing them,
Yeah, it doesn't
that's what
really
I
matter.
care about.
Okay.
The must-haves for me are oil pulling once a day,
Okay.
tongue scraping once a day, cleaning in between the teeth once a day,
Okay.
and brushing your teeth once a day.
Twice a day.
But twice a day for most,
Each day,
right?
yeah.
Unless you
Okay.
know what's going on.
Yeah.
But
Don't want-
all the studies, even the things that they teach us in dental school is that plaque is only bad if it's over 48 hours. So you could brush your teeth once every 2 days if you wanted to.
Mhm.
And all the studies that the dentists used to do were leaving everything on. They didn't get decay until they didn't start seeing the white spot lesions on the teeth until after 2 days.
Ah.
Okay.
So, but
it's
they
a feeling that you'd want in
Yeah.
your
Yeah.
mouth
I
for
want the
most
feeling,
people.
gosh,
Yeah.
when you're flying and
Yeah,
it's
yeah,
horrible.
yeah.
I have to do it at least once a day.
Yeah.
And twice a day if I'm not coconut oil pulling, right? Because I
Okay,
want that
of
feeling.
course.
Yeah.
Yeah.
So the coconut oil gives you a lovely feeling, I think,
Yeah.
afterwards.
And the copper tongue scraper as well.
Yes.
Copper's the best because I don't know much about Ayurvedic, but that's the one that works with all the doshas. I know you mentioned Vata earlier. We were just chatting.
Yeah.
And that's supposed to be the best one for that. So,
And most of us are deficient in copper.
Yeah.
When you scrape your tongue,
Yeah.
you get
Yeah.
copper in your mouth.
So just thought I'd add
So-
that because some people use like the plastic
Plastic,
ones
yeah.
and there's
Yeah.
like microplastics, whereas copper tends to work for everyone depending.
Yeah, I
Yeah.
remember
Doshas as well.
hearing that literally when you wake up in the morning, all the toxins from your body end up on your tongue. So that's
Yeah.
why the
Yeah, to
AMA,
remove
they
it.
say
Yeah.
in Ayurveda, and then you remove
all the
it.
old stuff.
And
Making
yeah, it all
sense.
makes so much sense. Quickly, I wanted to get your view on fluoride
Mhm.
because we personally don't use fluoride toothpaste in our house. But I took Sufi to see a dentist and she almost insisted.
Yeah.
And then Sufi was like, Mummy, we need to use fluoride toothpaste. But I'd love to hear your view on fluoride and whether you recommend it or is what you do recommend. What
So
toothpaste you
I
recommend.
think if you think about what causes decay in the mouth, it's the bugs living in there, the wrong type of bugs, the ones that are more prone to cause, it's Streptococcus mutans are the ones that cause decay. They're the ones that have most been tested anyway. So if you have a high balance of Streptococcus mutans in your mouth, you're more likely to get decay. But what does that come from? It comes from the foods you eat. So if you're having refined flours, refined sugar, the bacteria in the mouth can break it down quicker, which leads to acid. It's not bugs that indirectly it is. But what happens is the bugs break down the refined things in your mouth and create acids as their byproduct, an endotoxin, and that's what destroys your teeth. And then your teeth and your body are not remineralizing quick enough to keep up with it. So what's the root cause? Food, nutrition, minerals in the body. So that's from the inside out. And then from the outside in is the remineralization of the teeth using something like fluoride.
Okay.
So fluoride is very good at making teeth strong. You can't argue with that, even as a biological dentist. But there's more than enough evidence now to show that it disrupts the endocrine system and it's neurotoxic. So for me, why would we want to use that in anyone? You get to the root cause of things. And the other big thing that no dentist talks about is teeth. If the person is not imbalanced nutritionally, they crack and they break, especially if someone's clenching and grinding at nighttime. And how does that manifest? It manifests as decay in between the teeth. And every time I do a filling, I can see that there's a tiny little crack there and then there's decay starting underneath it because you can't clean a crack in between it, can you?
Mm-hmm.
So for me, fluoride, have I ever used it in biological dentistry? Maybe once or twice when someone's got decay everywhere. Will I tell them to use it forever? No, a couple of months until it's understood, until they're on course. And then actually, you don't need it now. So the toothpaste that are on the market now, right, are the ones, there's two reasons we want them. One, to remineralize the teeth, and two, to be kind to the oral microbiome. And remineralizing the teeth now, fluoride remineralizes teeth, but has the problems in the body. But you get the natural compound hydroxyapatite, and hydroxyapatite is what your teeth are made of. That is calcium phosphate crystals. That's what our teeth are, the strongest thing in the human body. That's why you have to give it to pigs in all the gangster films because nothing else breaks it down. So you brush your teeth with something that's going to remineralize it. You've got like we went to a health food store yesterday and we're looking at all the toothpaste. None of them have it in, none of the natural toothpaste.
yeah.
No, I ended up ordering a hydroxyapatite toothpaste from the States. I
Yeah.
know there's some now, there's a brand called Boca that I
Yeah.
used to order.
Yeah.
But I know Health now sell one.
Yeah.
It's Wellness.
Yeah.
there's
They do a
Wellness, yeah.
hydroxyapatite. Which, are there any
Yes.
brands that you recommend?
My favourites are Wellness, Gutology, and Dimples. and the charcoal one from Wellness as well. Because
Okay.
charcoal is, the other minefield is that natural toothpaste are not abrasive. So you get more stains when you use natural toothpaste.
Okay.
So you need to be using a charcoal once a week, twice a week.
That draws
your
out
teeth.
the...
Yeah, exactly.
Okay.
And nano hydroxyapatite as well.
Okay.
You want non-nano.
You want non-nano?
You want non-nano. So it's a bit like
Okay.
people using like
Nano, like sun creams.
sun cream.
Yeah.
You want
Yeah.
non-nano.
Yeah,
Only
same
because
principle.
it's such a small particle, we don't know where it's
There's
going
no
to end up.
science out there to show.
There's
There
a
is
few
actually.
yeah.
There
There's a
is.
few research articles
It's the
linking
same things as fluoride. It goes
Okay.
into the endocrine
Yeah.
system, thyroid, problems like that. So
breast cancer, people who were using nano, and there's a higher risk of
So
breast
are
cancer.
there brands with
Mhm.
nano?
Yeah.
most
None
of
of
the
them are.
Most of
originals
them are.
were nano.
So which out of the ones that you've just
None.
mentioned?
None of
Oh,
them.
they're all
They're
good.
fine.
So,
Okay.
Yeah,
so
yeah,
you're
yeah.
safe, guys, to
Yeah.
have those.
Yeah,
ones.
they're
Okay.
fine.
Yeah.
But my favorite is the gutology one, right? Because it's one biomimetic, which means body identical. And it's got the highest that I've seen concentration of hydroxyapatite, because most of these other brands just have it in a solution, which is in
Okay.
water. And they've got the actual mineral in there. And the other thing is that it's got probiotics in it. So the good bugs for your mouth at the same time as brushing your teeth, rather than taking a supplement or a mouthwash.
That
for
kind of
that.
makes sense,
Yeah.
doesn't
So
it?
it's like a
Yeah.
supplement in a toothpaste.
Okay.
So that's my number one at the
Going to be
minute.
ordering
Nice.
this straight
Yeah,
after.
Yeah.
it's so good.
And then whilst we're on product reviews, you were talking about mouthwash, like a salt mouthwash. Like,
Yes.
what are your views on mouthwash?
In general, like stay
Yeah.
away from normal mouthwash.
Okay.
Because it's like a napalm strike to the mouth. It just destroys all bugs, good and bad.
Mhm.
But remember when I was talking about the microbiome balancing,
Mm.
you want to destroy bugs sometimes. Like when I was in my health journey, I had to cleanse and restore my gut. I had to destroy everything first, and I had to rebuild it with, good bugs, let's
Yeah.
say, commensal bugs. So sometimes we do use mouthwashes to destroy the bugs for a period of time, like a month. And then we remineralize with the probiotics and mouthwashes, the good
Okay.
mouthwashes.
So what is a good mouthwash?
A good mouthwash. I just use salt and
Salt water.
yeah, salt water. You
Okay.
just make a batch up. You put a one with a lid on it, and then
Yeah.
you just
Any
use that throughout the
particular
week.
salt?
So Celtic is
Yeah.
Table.
Nice.
Yeah.
Yeah.
No.
Celtic or Himalayan,
Okay,
right?
nice.
You're not actually you are ingesting it, aren't
Yeah.
you? But I mean, so the other thing is essential oils get a bad rep in the mouth because they are like antibiotics too. If you
Mhm.
use the higher
They're quite
concentration of
strong,
them,
yeah.
so they destroy good and bad bugs as well. So. But this is like anything. If you have a small amount of something, it's not going to be bad things.
Yeah.
So like even essential oil mouthwashes are okay. The Risewell do a good one.
Okay.
doTERRA do a good one.
But it's not
So if
something
you
you use all
feel-
the time.
I
yeah.
don't use it all the
For
time.
people who really feel like they need that.
They need it.
Okay. Then
They're
it's
the
a better
ones.
option.
You want one that's not going to destroy the bugs.
Okay.
Yeah, so actually mouthwash, Ali actually just mentioned a product called Iron Biome, which we use as a gut thing, right? But you can use it as a nasal spray for the microbiome in the sinuses and nose. Just put it in a spray bottle. Or you can use it in your mouth and obviously drink it, don't you? But you can hold it in your mouth for 30 seconds, swish it around. Because that's going to...
Almost as a mouthwash.
As a mouthwash.
By the way, guys, we're talking about a product that Zach Bush
Yes.
has brought out, and it's
Can
incredible.
we
I
do
give it
little
to
love
my...
hearts?
Yeah, we all
Yeah, I give it to my girls and they ingest it every day, but I didn't know you
Yeah.
could use it as
Absolutely.
a mouthwash. Yeah.
And that's something we're trying to do in the clinic now as a mouthwash. When you sat there, we just have distilled water at the moment, instead of like the toxic things in the cups, but using the Iron Biome in that as well for the patients in
Oh,
the chair.
really
so they're
nice,
getting it.
Yeah, exactly.
And also, even a lot of supplements, they do say hold in your mouth for 30 seconds before you
Yes.
take them in, because obviously the absorption.
Yes.
But isn't that also crazy that we can absorb so much through our mouths, and yet
We don't
we're
think about it.
brushing our teeth with
Yeah.
things that they say do not ingest?
Yeah,
Yeah.
I know.
That just doesn't make sense, does it?
Yeah.
And
But
that's the
and
Matrix.
yeah.
It's crazy. What struck me when I was learning about the medical side of dentistry and doing the doctor part of the training was if someone's having a medical emergency, you have to spray GTN spray under their mouth when they're having a heart attack, because that goes instantly into their bloodstream.
Wow.
And I thought, well, if this drug can go straight into the bloodstream like that, why are we ingesting all these things?
Yeah.
It just doesn't make sense. And I was like, wow, you just don't. And it's because we're not taught about it. We're not taught about this stuff. But if anyone listening just looks in a mirror, lifts up their tongue, you can see big blood vessels, like massive blood vessels.
True.
So it just goes straight into the blood.
This year, let's say no to microplastics, no to toxins, and yes to clean, healthy hydration, because water matters more than you think.
We're made up of 60% water, so what we drink literally makes us who we are. Enter Win-Win Water, the game changer in pure toxin-free hydration.
Most tap water is full of chemicals, fluoride, metals, hormone disruptors, and even medications. And unfortunately, most bottled water is made from fossil fuel-based plastic, which can leach nanoplastics into the water we drink.
That's where Win-Win Water comes in. Not only are all their bottles 100% plant-based, made from sustainable sugarcane, but their water is locally sourced mineral water that is naturally high in electrolytes and minerals. No need to add anything in, it's just as nature intended, real, live water.
So we're huge advocates for the UK-based water company Win-Win Water. For us, it really is the starting point for health. If you're drinking the best quality water with no toxins, your body will thank you for it. And in this case, the environment will thank you too.
Win-Win Water are currently offering 10% off subscriptions with the code RAISE, so that you can get the best quality water delivered for you and your family directly to your door.
Visit winwinwater.co.uk to find out more.
That's so interesting. So are there any things in particular that you should, so any symptoms, for example, that people need to look out for in their mouths that are kind of screaming that they've got an issue?
So in terms of like our patient base, we probably have 20 to 30% of patients that are, let's say, chronically ill and looking for answers.
Mm-hmm.
So low grade ME, chronic fatigue, what's going on? Why can't my body regulate? All this type of stuff. We've got like probably 30 to 40% of biohackers, people that are wanting the best out of their body. And they understand that the mouth can be a source of that, or their sleep can be a source of that. And that's, biological dentists can help you understand that. And then the others are just people just wanting a good dentist, I guess, that looks at everything just to keep, well. So for me, the piece that most listeners will probably not even thought about is the airway and how a biological dentist can help with the airway. And when I say airway, I mean the collapsible part of the airway behind the tongue. Because behind the tongue is just a muscular tube. You've got the tongue in front of it. So if the tongue falls back, blocks the airway. Most people will have heard of obstructive sleep apnea. And obstructive sleep apnea is a medical condition that people die from, cardiovascular problems, all of that type of stuff, right? But there's this grey area before that, which we call sleep disordered breathing or upper airway resistance syndrome. And those syndromes are you're snoring, you're clenching your teeth, you're not breathing effectively, you're waking up, your sinuses are stuffy, and you're waking up with no energy. Some people don't even know they're doing it, but that's the typical symptoms. So then when they come into the clinic, we screen for wear and tear on the teeth from clenching at nighttime. And we've just invested in scanners actually. So we scan the whole mouth now, and it actually measures a time lapse of their wear and tear on the teeth. So every 6 to 12 months, we can do another one. We can see is there more wear. So proper data that you can actually tangibly look at. And scalloping on the tongue, because what happens is, it's hard to talk about scalloping on the tongue. Basically, if you stick your tongue out, you'll see like ridging around it. And that will mean that your tongue falls back, it blocks the airway, your body goes into fight or flight, it pushes your tongue out of the airway.
Do you want to do a little demonstration? Because that's quite handy if you can do it.
Yeah, so the demonstration.
Because you showed me and I was like, oh, that makes sense.
The airway demonstration.
Yeah.
So
Okay.
This is the spine, this is the tongue. Most people's tongues live in the wrong place. The tongue should be living in the roof of the mouth and sealed to the roof of the mouth, lightly suctioned up there. So if it's lightly suctioned up there and you fall asleep at nighttime, it's not going to fall back. And your soft palate's behind that with your dangly thing, your uvula. So that's like a cranial and that catches it if it does fall back. But what happens is when the tongue's living low and someone's got poor myofunctional habits, it will just fall back and block the airway. And then they'll have to push their tongue forward, and they're in this constant yo-yoing of nighttime.
And
that's why they're tossing and turning. So if you're tossing and turning, kicking the sheath, sweating lots at nighttime, your body's normally going into fight or flight. And that can be like an airway issue. And the biological dentist, and this is the problem I was talking about, all those pillars, that most biological dentists don't even look for the airway, screen for the airway, anything like that. So 100%, that's something that needs to be done. And the easiest thing to do with that is myofunctional therapy to start with. Myofunctional therapy is simply just toning, strengthening, posturing, repositioning the tongue into the right place, screening or training the tongue to function in the right way. And if the tongue doesn't function the right way, one, it's because there's not enough space in there because there's been retraction orthodontics or the mouths get more crowded as we get older, or you've had Invisalign that's not worked and it's gone to whatever. Or there's a tongue tie, and there's so many adult tongue ties.
As if we've only just touched on tongue ties
so
now.
Tongue ties is like a posterior tongue tie, not a baby tongue tie that's picked up by most midwives. a posterior tongue tie is one that is attached too tightly to the floor of the mouth. And when you go into deep sleep, the only thing moving is your diaphragm. So when your diaphragm moves out, the fascia of the tongue gets pulled down and it blocks your airway. So, but you have to do the myofunctional therapy. You have to rebalance, re-strengthen, re-educate the tongue.
So is this what you guys have a course on?
This is the online
so if you want to
courses,
learn more about this, guys, then head over to their website and check it out.
And just, are they, is it exercises that you do or is it like tools that you use? How would you, okay.
Yeah. So you can just work with a myofunctional therapist.
Yes.
And they'll do like a personalized one for you. But I was looking for one when I was doing all my expansion and I couldn't find one. It is now gaining like traction
Momentum
and everything,
now,
which is amazing. But the course itself, we use like MyoBrace is the course. So it's a system in Australia. It's massive over there. They're much more forward thinking in terms of health. And then, so the myofunctional appliances, which is sleeping, it's kind of like a bite guard, but it's not too soft where your body wants to chew it at night. And it's not too hard where it's like uncomfortable and not really doing anything.
But it is soft, isn't it?
It is soft, but you don't.
But the reason most dentists don't like soft bite guards is because you chew on them, but it's not helping the airway. The reason, remember, root cause is the airway's collapsing, is why someone's clenching or pushing the tongue out the airway. If you imagine your back of the throat collapses, it's just muscle. So if I tense my throat and I clench, it opens it up.
Yeah.
So I can make myself snore if I go into a really weird position,
Please
right?
do it.
Right? And I'll stay in the same position, but I'll clench. It opens it. But that's what your body is. Yeah.
That's what you used to do.
But normally when we're on our back, you snore more because obviously the airway's collapsing when you're going against gravity.
Yeah.
And the tongue also falls back there.
Yeah, I constantly tell Ali to go on your side. Yeah.
And then this course you do for children as well.
And adults, yeah.
But can you maybe touch more on the children side of, I guess, like all health and development, you know, being mums and...
Yeah, this is a huge thing.
Yeah.
So the course was developed because Seb was seeing lots of these patients in the clinic.
Because it's my
They
passion.
were driving like 3 to 4 hours each way to see him for these assessments. And I was like, and it was having to have the clinic, clinic tax type and clinic time. And we had to factor that in. This was before it was our clinic. And it was just one of those things that the price of it it kind of made it a bit unreachable for so many people. If I'd have had myofunctional therapy when I was younger, I wouldn't have needed those 4 teeth out at all.
Wow.
Because it's teaching you the proper habits. So if you think your tongue's like the strongest muscle in your body, if you're
It's got 8 muscles in it.
If you're swallowing correctly,
2,000
2,000 times a day, and it's doing that upwards and outwards action and swallowing correctly. I don't do it correctly. I'm doing the course at the minute myself. So don't look at me. Don't look. It's always you taking your own medicine. Isn't it? And if you're doing that action correctly over the time, and then there's issues like with breastfeeding, if people haven't been able to breastfeed or people haven't chosen to breastfeed, then the baby is not learning how to swallow correctly, and also how people feed with bottles.
Yeah.
And the suction action, it's not
the nibs
needed
on the
that
end,
like
they're not the right
that
ones.
suction action. So it's something that as a society we're not aware that there's a correct way to swallow, and there's a correct way to position your tongue throughout the day.
But also living in this world, it's a very toxic world. There's a lot of allergens out there. People are more inflamed. What does that impact? Nasal breathing.
Yeah. So
when you can't nasal breathe, your tongue has to be low. You have to mouth breathe.
Yeah.
So then you're like, well, I'm going to be a really quick eater because I've got to mouth breathe because I can't have
fussy children who don't want to eat their dinner. It's often because they can't breathe through their nose whilst they're eating.
Yeah.
Okay.
ADHD.
Yeah.
So many things. There's so many things.
The ADHD is more about the depth of sleep that they can't get into because the airway is collapsing.
Yeah.
So if you like the testimonials we've had, even from the online course, before I was doing it in clinic for 3 years, and the results we were getting are amazing. Focus, concentration, waking up with energy in the morning. And also, by the way, this straightens teeth, right? Because the teeth that dictate, right? If you think about a growing individual, a growing child, their teeth, and this is why we can do orthodontics really well when they're young, is the bone is soft because they're growing. And the teeth push on the bone. But if it's a negative movement, so I always say on the calls and to the families that teeth are like sails and they live in the neutral zone. So if the lips and cheeks and those muscles are pressing in, someone's swallowing with their face or using like a really exaggerated swallow, and the tongue is not going up and back and pushing out on the top jaw, then those teeth are constantly getting pulled in as they're growing. So then you're looking at crowding, you're looking at more clenching, you're looking at mouth breathing.
You've explained it so much better than me. That's what I was trying to explain with that, which was why I said if you have braces,
that they say that now faces are getting narrower. And I know you touched on Western Price, didn't you?
Yeah, Western Price and all of that. That was part of my journey, and the food and the K2 and all of that. It's also heads on phones, looking down, that neck posture. It's the inflammatory things. When I'd had my teeth out for braces, I couldn't breathe through my nose because if you think my mouth was like that, and then they make it like that because they've taken 4 teeth out, and it goes from
What doesn't get smaller though? The tongue.
Yeah.
So where does the tongue go when they make the cage of the mouth, the teeth smaller? Further back in the airway. So it puts you more at risk of clenching, grinding at night time.
And the roof of the mouth is the floor of the nose. So if we're making the roof of the mouth narrower, we're making the nose smaller. So I couldn't breathe through my nose. So it became a mouth breather, which is such a habit to get out of. Like I still catch myself doing it now, even though like I've got the room there.
Did you guys both mouth tape?
Yes, so mouth tape. Yeah, I've been doing that for about like 9 years. So I tried like 9 when I was doing my whole like research of what other people were doing, but I couldn't breathe through my nose, so it became a problem.
Do it, could you, when you first found out about
I've been trying.
So did you use the because I heard you mention the dilators? Because I've used the ones that stick on top of your nose, but I've not tried the ones you've had. The ones that go inside.
So there's mutes, which are inside the nose. I'm really sensitive, so they like tickled me and like it's like I can't sleep. I use a brand called Intake Breathing, so it's a plaster on each side of the nose. Health have now got them, which is great. Because before it's from America, I like went to Ibiza with my little sister and like my best friend last year, and I was like, I'm in Ibiza with my nostril stickers and
mouth tape.
I was like, I don't have to do things, but they really help because it's like a magnetic band. So if you're sensitive, it doesn't bother.
In the nose.
Okay, and then because I had a brand that actually ended up pulling my skin off a little bit. It was so strong. I won't
try these Intake ones. They're the best I've found.
My favourite are the in-nose ones though.
Yeah, you like the in-nose.
Okay, I've not tried them.
You physically know that your nose is not going to collapse.
Yeah.
So there's 2. Mutes are one, but they're not great forever. M-U-T-E-S.
Okay.
They're on Health too. And then there's another brand called
Mammoth.
It's called Silent Mammoth. And they're like silicone with like a little bit of metal in it. And they're like mammoth, the heart tusk, and they go in and they just hold the nose open. And they last for ages.
I think that's the ones that I've got. And it makes your nose feel really funny and big because it like really opens it up. But
my thing is you should be using them when you're exercising so you can nasal breathe for longer, change your brain chemistry. But then also when you're sleeping, because when you sleep, and my nose is a good example, it collapses. I've got a dodgy nose. So if your nose collapses...
We'd never noticed that.
If your nose collapses when you're asleep, you then can't breathe. What do you have to do? Clench, push your tongue forward, open your airway. So for me, the first route of good airway sleep is nasal dilators while you sleep. Okay. Because then you know that you can breathe through your nose. Because otherwise you're going to have to breathe through your mouth.
So, sorry, just quickly while we're talking about the children.
Yes.
My daughter definitely, she sleeps with her mouth open. What can parents do if their children...
How old is she?
7.
7. It's the perfect age. So like, you know, the conventional way is, wait until 13, 14, then let's move teeth around or take teeth out, which we don't want to do. So if we notice these signs of airway collapsing, let's call it, and mouth breathing at nighttime, which is like the end position because you have the clenching, the grinding, the pushing the tongue forward. And if they don't work and they can't breathe during that, then they have to open their mouth to breathe because that's the fail-safe, right? So what we then have to do is create room by getting the jaw bigger, get the tongue stronger, check for something like tongue tie, check the nose isn't collapsible. But in kids, I get these silicone appliances that Ali was talking about, put them in, get them to press their lips together, breathe. They can breathe perfectly through the nose because it gives them that space in their mouth. And then you end up mouth taping them so it doesn't fall out at night time. But you have to build them to that point.
Yeah.
But because those teeth are like sails, if we wear an appliance at nighttime, we train the muscles to be in a more balanced neutral zone, which is further forward. Everything pushes out. The teeth change position while they're growing because the bone's soft. So by the time they get 10, 11, they don't need any braces. They've got all their teeth in their mouth then. And then we can keep them sleeping in the appliance until they've got their teeth in their mouth, and then that's it. No braces.
That's where the course came about.
Yeah, so that's amazing. Yeah.
So the course came about because you were getting patients come into the practice, having to drive a long way to do these like check-in calls. So it's now all online. So they get a check-in call. We've got a myofunctional therapist. So they have the assessment we've said first of all. Then if you want to go ahead, you go ahead. It gets posted out to you. There's an online classroom with different lessons and like activities of, do you want to demonstrate some? They always tongue press and hold. Puff a fish. So there's loads of different ones. But it's all like exercises and like learning
Muscular.
to
So this is what children can do.
Yeah. And so
Great.
we've got a
So
children
good.
one, and then they have a check-in call with Annie, who's our myofunctional therapist, who's lovely.
And we just employed Caroline, who's also
and
my
another
functional
one
therapist
because
now.
Okay.
the demand's growing. And
Amazing.
then the Myo braces, we've got some like lip trainers
And we get the
things like
cutest
that.
little messages from parents at the end, you know,
I
like
know,
with
they're
pictures
really
at the
cute.
beginning and pictures at the end. It's like, my daughter smiles all the time now. She loves her teeth. And she's only like 8.
Oh,
And it's just like,
wow.
because the teeth have changed so much in that
Yeah.
2-year period. Well, of course, it only takes 9
Concentration.
months, but you can
Okay.
take as long as you want,
Yeah.
right?
Okay.
Before 10 is better.
Okay.
Because
I'm
that's
gonna
when
get my
things
Yeah.
cement.
kids on
Okay.
this.
The hard thing is compliance.
Yeah.
So
Mm.
that's why I have that initial call with them to really convince them this is the right thing to do.
Okay.
Because, you know, for me, I remember going to the dentist, they speak to the parents and never to the children.
Mm.
And for me, it's the children get it. And if you put something in the mouth, you get them breathing, you show them things, you tell them why, they'll be like, yeah, I want to do this. You know, I don't want braces when
I
I'm
love that.
older.
Yeah.
And that's it. You have to get them to understand why we're doing it. And that's where the real passion comes in.
Amazing.
That was how we created the online
Okay.
course.
Mhm.
Yeah, and we've got people from all over the world. We've got Australia, America,
Africa.
India,
Wow.
all over the place.
Yeah, 'cause
so
we've made
we've
it
got
so good.
Yeah, so we love that. And then we created an adult one because
Mm.
people were like, how do I do this
The
as an
problem,
adult?
Yeah.
the problem with the
Yeah.
adult one is you're not growing anymore.
Mm-hmm.
Yeah.
So what will happen is the muscles relax and your jaw will change position, and then you need to change where your teeth bite.
Mhm.
So that's the hard thing as an
Yeah.
adult because your jaw's not growing, but it helps them breathe at night time. And
Yeah.
for me, that's more important. And I always tell them at the beginning, you know, that you might need orthodontics or you might need, you can do things like put extra height on the bottom teeth in ceramic or something to get them biting in that position. Because normally what happens is, imagine everything's too far back and the airway's collapsible and then the muscles relax and the jaw wants to be here. You've got like little gaps in your teeth, haven't you?
Yeah.
So then what happens is fine because that's good for your airway, but you can't chew your food effectively. So we have to just build up on the teeth to get you biting in that position again. But yeah, that's the caveat with adults. But for people that really need it, you've got to do it.
Yeah.
And are there any foods that you recommend that can help with like remineralization or with chew? You know, what's your kind of diet like, or what would you recommend to patients?
Well, Ali, remember the wisdom, the root cause protocol. Have you guys heard of that one?
I have. I don't know much
Yeah.
about
Yeah.
it. I've heard it.
Yeah.
Yeah.
I think Western A price is much more accessible for people though.
Yeah.
And that's something we've been doing for a long time. So
Yeah.
was he a dentist?
Yeah.
Yeah,
It was a
he was.
dentist
yeah.
that went round all these
He was the
like,
head of the American
Yeah.
Dental Association.
no way.
And he wasn't afterwards.
So he went around all these like traditional tribes on the pretense of why is everyone getting decay.
Yes.
But what he also realized was when you analyze the mouths of even like twins,
Mhm.
and one was living in like a Western society and one was still living in like these more like indigenous cultures and eating that diet, the arch tends to go like a V, the palate goes up,
They get decay.
they get decay
get
and things
crowding.
like that.
When you eat a regular,
Mm.
A
soft
Western
food
diet.
More
not
Soft
nutritious.
diet, like Western diet rather than the Western A price diet. So it's just more like
That's why it didn't stick.
ancestral eating. So we have a little shop at our clinic. We sell quite a lot of the products to try and help people. So when they're in that mindset, so things like fermented cod liver oil, so high in, so we called it
Or even
Activator
raw.
X
Yeah.
because he didn't know what it was, but it turns out it's K2. So you can get it from like fat soluble vitamins.
Farm to table, nose
Yeah.
to tail. Basically, food nutrition is what you want to be eating. Organic, if you can afford it. If you can't, rinsing it in essential oils just to get the pesticides off. Or having iron biome, you know, with it. So it protects against the glyphosate.
by the way, that's spelled ION,
Yes.
Yes.
not iron as in
Yes.
iron.
Yeah, iron.
Yeah,
Yeah.
exactly. And then it's,
Like liver capsules.
yeah, if you're going to supplement, do the things that are nose to tail kind of nutrition. So we literally have
So like
every
organ meat supplements.
Yeah.
Okay.
And we've gone heavy into the organ stuff. And, you know, even like thyroid organ, you know,
Yeah.
things that you're
Yeah, I've
not
been
even
taking
ingesting.
brain.
Yeah,
Yeah.
for
Wow.
specific
They do- yeah.
things. Yeah. So my weak point's my thyroid. So I've been taking, it's like for like, it's like homeopathy works like for like. So
You're
taking
getting the
it
nutrients from that organ that you're deficient in.
Yeah.
yeah,
Mhm.
That
and
makes
doing it
sense.
like that. Like raw milk.
Yeah.
Raw milk's a really good
Yeah,
one.
you're going to have any milk. Don't have normal
Yeah.
milk, obviously. Raw milk, obviously, you can't even get it though. But
It's really hard to get.
A2 is the variant that you
Yeah.
want to have because
Well,
it's got the enzyme in it to break it down.
There's a few online stores that you can actually
Mm.
ship
Yeah.
A2 raw
Yeah.
milk.
Exactly.
And I think there's a website called Raw Milk Producers,
Yeah.
and
Yes.
you can actually find a list of whether
Nice.
there's
Perfect.
farms close
Yeah.
to you,
So
and
go and
also all the
look.
online stockists as well.
And
So check-
Carpet Foot as well.
What's it called?
So
That's how we found it, wasn't it?
after my health thing, I became really like aware, and I was like, I don't want to eat animals anymore. So I ended up going vegan, absolutely trashed. We actually did vegan keto which was just the
Wow.
worst thing ever. I don't
Yeah,
know
it
what
was
we
hard.
ate. We lived off coconut, literally. But my hormones were trash. So that's why I'm now like working to try and get my thyroid back and sorted and everything. But then when I wanted to start, like my body was craving like nutrient dense stuff. And yeah, so I looked at, that was my way into milk. So those people who are like, oh no, I don't know how I feel about milk. For me, that was a really good like mental step to be able to have milk again. So it's called calf at foot. So they keep the calf at the foot of the cow. So it's like really, really ethical the way that they do
Don't take
it.
one part.
Okay.
Yeah. So, and if you think about like
Oh, yeah, this
energies
is
and things
interesting.
like that, like the stress hormones in the milk. So you're getting like less stress hormones
Yeah.
as well.
Because she's
Oh.
So, because mama cow's happy as well. So
Yeah.
there's a website called Calf at Foot, and most of those ones on there are raw milk as well.
Amazing.
So if
Thanks
that
for
was
that.
like one of those things, because that was at the back of my mind, like I was craving, feeling nourished, but I was like, oh, don't want to do it. Because I was like vegetarian when I was little and then vegan for however many years. That was my step in. And now I'm like full on like organ meats and like
Steak.
beef sticks. And
Yeah,
steak.
love a beef stick.
Yeah,
Literally got
literally,
one of
those.
yeah, literally beef sticks everywhere.
It is so funny.
Colostrum's a really good thing to add in as well.
Yeah.
But yeah, if you could look at like the Western A price diet, there's loads of people doing it on Instagram. now,
Stephen
things like that.
Lynn, the biological
Yeah.
dentist from Australia, wrote a new book, probably 2019, called The Dental Diet.
Mhm.
It's basically
Ah.
Western A price revisited. So
Yeah, it's really
We were
that's
going to
got
ask, that
all
was one of our
recipes
questions.
and everything in there.
What books you
Yeah,
recommend?
really
So what
good
was
one.
that called?
The
called The
dental
Dental Diet.
Yeah.
Okay.
Yeah, Dental Diet.
More approachable. Like I was listening, I was like, this is Western A price is research, but it's in a much more like modern
does
way
reference
rather
it.
than and he says that and he adds a lot of like wisdom to it.
Yeah.
So that's a good resource as well.
New audiobook.
Yeah.
Yeah.
Yeah, it's really good. Really, really good.
And we're going to have to finish up soon. But if someone was to incorporate just one of the like all health hacks that you've spoken about today, which one would it be?
It's going to have the most effect on the body. It's
Yeah.
hard, isn't it?
Like if they didn't do any of them, or which one would
Probably
you?
coconut oil pulling.
Oil pulling to start with,
Yeah, I
that
would
one
say that's
first.
a good way in. And that was probably one of our first things into natural
same.
health.
Yeah, it was. Yeah.
And it's because it does all those things that we talked about, the microbiome, the myofunctional stuff, which is going to help with your airway. Remember that airway collapse stuff. And also coating the teeth so you don't get as much plaque and calculus. So no gums irritation, no decay potentially. So yeah, I believe that that's a really good route in. And start small and build up. Because they say 20 minutes, the research is 20 minutes. But that's why I do all the other things while I'm doing it, because it's in my mouth for about 20 minutes.
Quite a long time just to be stood there, isn't it?
Yeah.
Exactly. And you can't do that.
No.
Not in this world.
So build up from like
Like a
5
couple of
minutes to 10
minutes or
minutes.
something.
Yeah,
Yeah.
because
And
it
it's
is.
normal for your jaw to ache as
Yes.
well.
Yeah.
Mine
Because
still
people are like,
does.
oh, have I done something wrong? Is it aching? And it's like, no, it's meant to do that.
Yeah. It's relaxing. Well, it's not. It's training your muscles, isn't it? So,
Yeah.
but it's training them in ways that they've not been trained before. So it's like re-strengthening like the supporting muscle, which is why functional fitness is good, right? So you're doing all those like different types of muscles rather than just bench press, which is just one muscle
Yeah.
group. So you're doing physical movements of actions that you do in real life. And it's the same thing that you should be using your tongue in this way. So it's getting you close to that, using all those supporting 8 muscles in the tongue. So yeah, I love coconut oil pulling.
Guys, thank you. This has been, I feel like I've learned so
Yeah,
much.
me
This is such a
too.
lovely conversation.
Oh, that's
Yeah.
amazing.
And thank you for taking
Thank
the
you for
time to
having
come
us.
on today. Really enjoyed
Yeah,
it.
thank you. And thank you
And-
for doing this message for everyone, everyone you're speaking to.
Thank you. And if people want to find out, just quickly, if people want to find out a little bit more about you, they can find you on Wonder of Wellness. Your Instagram is Dr. Seb, biological dentist.
_dentist. Yeah.
Okay. And Ali?
Is I am Alexandra Lomas.
Okay, fantastic.
Not too much on this, but obviously when I've got time, bit of farming, bit of interiors, a bit of wellness tips.
Nice.
Amazing. Thank you
Thanks,
so much,
guys.
guys.
Thank you.